Hello everyone, I'm Azita Arvani of the Arvani Group, Mobile and Wireless Strategy Consultants. We are here at CTIA show in San Francisco where I'm chairing the Mobile Health Devices panel. With me is a panel expert, Alex Brisbourne, who is President and COO of KORE Telematics. KORE Telematics is a machine-to-machine, or as they call M2M service provider. Alex, thanks a lot for being here with us.
Thank you for inviting me.
Sure. Alex, we know that mobile health is a unique kind of machine-to-machine service.
Correct.
So what are the special requirements of mobile health in contrast to other machine-to-machine services?
I think it's very interesting. I think there's three areas specifically. The first is the devices themselves have to be custom designed for a very specific niche application. They're to do with form factor, battery management, the ergonomics in use, and so on. And yet the people that are designing these applications typically come from a health management background, not a wireless communications background. And so they face some very interesting challenges of blending these two technologies. So in the very front end, we try to help them through that process, both in terms of design as well as the technology and regulatory related aspects. That's one. The second is that for critical applications, the key here is ultimately reliability. Just buying a wireless subscription is just not enough.
Right, right. It has to have quality of service, right?
I don't really want, honestly, a critical care patient, not being able to be connected because he's gone inside a building and somebody hasn't designed an antenna properly in a device. Sounds simple, it's not simple. And so the design of the network that supports this, and the systems and platforms and services, all become a cohesive element. And the third area is how do you make it cost efficient to deliver those services? Because at the end of the day, you have to have a return model that makes sense, whether it's an individual buying the service, whether it's an HMO buying the service, and as a result, you've got to look at how you optimize the use of the network, charges in the network, and what information is going to be useful in ultimately affecting the patient outcome.
Yes, that was very well put together, with the three big basic parts to it. Now, what do you think is the biggest myth about mobile health?
The biggest myth? Interesting question. I think that it can bring immediate return. I think one of the challenges here is that it really is requiring some level of behavioral change in the patient. Long before you bring a behavioral change in the managed care organization.
Right.
If we don't want to actually look after ourselves, we're probably not going to do a whole lot about it. And how do you affect people's behavior? Honestly, in the pocketbook.
Right, right. So we have to financially
so we've got to financially incent, induce, whatever we want to call it. There's got to be a mechanism where there's a reward for them in utilizing this technology. And
the reward is not necessarily just better health.
No.
It's other sort of short-term gains like financial incentives.
I think most people think they're healthy until they're not.
Right. Right.
Whereas in reality, there's a deteriorative process, and the whole point of having certainly wellness management systems, and really we can separate wellness management from critical patient care. Wellness management is something which is a creeping benefit, and we are pretty bad at it, actually. We're far better with our automobiles, than we are with our individuals. And I think also we've got two different dimensions as well. That is that it isn't a universal problem anywhere in the world. In overseas markets, particularly developing marketplaces, it's about access to healthcare. In our market, it's ultimately about efficiency of delivery of healthcare. And I think we've got to get quite laser-sighted on understanding what the financial implications are.
Sure. So how big of a market is mobile health to KORE Telematics?
Growing quite rapidly, admittedly from a relatively small base. But to give you a couple of specific data points, we started to focus in from a business development perspective in this market, partnering with some small and larger organizations back in 2008. And in 2008, the number of additions to our network which were health related was less than 1%. In 2009, it was 19%. In 2010, in the first 8 months, it's 23%. Now, that, and by the way, the rest of our business is growing too.
Right.
So it isn't simply a change of dimension, but it's very specifically working with 14 or 15 organizations that have got the seeding applications out there, from clinical trial applications to sleep apnea control to glucose monitoring applications, that are being rolled out in the tens of thousands. So we do certainly see momentum there, but I'm still talking about tens of thousands, not hundreds of thousands. So we're clearly still at a very early stage of evolution in this industry.
Great. Alex, thank you so much for your insights. Really appreciate it.
Thank you very much indeed for inviting me.
Sure. I'm Azita Arvani of the Arvani Group. We are a business consulting firm that specializes in helping companies that want to develop and execute their mobile and wireless strategies. For more information about my conversation with Alex Brisbourne of KORE Telematics and other mobile health series, check out arvanigroup.com. Thanks for watching and be well.